If you have erection problems, it can be a warning sign that within the next 5 to 10 years, you may well have a heart attack or a stroke. And so it's a point of getting men when they have erection problems to actually, that is the point where they should have medical intervention. And so many men don't. So many men don't. And I've seen in GP men who started getting maybe Viagra like in their 50s, and then, but nothing was really done to work up their risk of a heart attack or a stroke. And then they had a major heart attack.
My God.
Late 60s, yeah.
That's fascinating. And also, that's not well known. I've never heard that
No, right. But every man should know that. Like
Yeah.
that if you're having loss of morning erections and erection problems during sex, you should be thinking about your risk of heart attack and stroke.
Wow.
Yeah.
Talking about symptoms,
Mm.
and let's focus on testosterone.
Yep.
Because we'll talk more about sexual function later on.
Sure.
What are the common symptoms of low testosterone?
Yep. So I guess the first thing to say is, so testosterone deficiency is a low level and symptoms together.
Right.
And so you just a one-off low testosterone level doesn't mean you have testosterone deficiency.
Okay.
You have to have several levels, or at least 2 levels, to check that it's consistently low level. That's the first thing to say. But common symptoms and the core symptoms, which every man should know, are these certainly 3, if not 4, which is the loss of sexual desire. Like you just don't want to have sex anymore at all, or it's just disappeared. That's kind of number 1 specific symptom. Lack of morning erections, difficulty with erections during sex, and fatigue. So these are like your 4 core symptoms of testosterone deficiency. But the problem is that if you take a big population of men and you ask them about these symptoms, a lot of men, so about 1 in 4 men, will have those symptoms even with a completely normal testosterone level.
Mm-hmm.
And that's the art of medicine, is saying, are your symptoms, these things you're suffering with, loss of sexual desire, for example, is it medical? Or is it that there's actually a major problem in your relationship you've not addressed? Or you have huge anxiety about sex, and so sex becomes super stressful. And of course you don't want to have sex. That's completely understandable. Sex has become super stressful. Or you're working night shifts and your circadian rhythm is all messed up. Lots of other reasons, basically, other than testosterone.
Wow.
And so the kind of appeal of it, and the truth of it is, for men who are truly testosterone deficient, you treat them, their sexual desire, their erection, changes.
Mm.
But there are also a lot of men who have those symptoms where testosterone is not the issue. And it's trying to piece that, work out what's going on.
Is it possible to get a 60-year-old to the same level of testosterone that they were at the age of 21? Can you reverse time in that sense?
With medication or with...
through medication.
Yeah, absolutely. I mean, that's what testosterone therapy is, right? It's just replacing normal levels. So if you've decreased... So you might you'd aim to get someone certainly between 15 and 30 is a normal range for testosterone. So if you come in and you've got a testosterone level of 7 and you're highly symptomatic, then take treatment, which will usually take it up to 15 to 30, and somewhere between that, 20 and 30, depends.
Is there not an argument then for every 60 plus or whatever person in later life to just be on TRT?
No, because loads of men won't have a low level. So lots of men in their 60s won't have a low level, they won't have symptoms. So in terms of the balance of too much and too little medicine, and medications, and are not without risks. Yes, testosterone treatment is pretty safe, but it's not without risk. It's not without cost. It's not without blood tests, which you then find other things. You start doing healthcare. You don't want over use of over investigating, over treating when there's no benefit is not a good thing. But if you've got symptoms at a low level, then yes.
So not just a 60-year-old gay man that's like, I want to feel as rampant as I did at 21.
So, but if you've got a level of 16, say 17 or 20, and I give you some testosterone, literally just replacing what you've already got, it's not going to make any difference.
So if anyone was listening to this, and whether they knew or didn't know their testosterone levels, what are some good supplements that you can take to improve them?
So there is evidence that certain supplements can increase testosterone levels. So some men take things like ashwagandha, but in terms of their improvement in symptoms, it's more equivocal. And so, again, some people find that some things are helpful. But again, if you've got a proper diagnosis of testosterone deficiency, in terms of the evidence for treating that with testosterone therapy and the difference that makes on your long-term outcomes, that's all based on testosterone proper testosterone rather than supplementation.
Right. Okay.
So it's a tricky one, but we don't have like lots of large studies looking at, okay, if you give men a load of men ashwagandha over like 20 years or 15 years, what happens to their cardiovascular risk? I just don't know that data. Whereas I can say with testosterone, if you have a low testosterone level and it's testosterone deficiency and it's treated, you're at, lower risk of long-term health problems.
Okay, so there's nothing you tell your patients alongside treatment. Make sure that you're taking this, eating this, drinking this.
So all, core lifestyle like advice in terms of cutting out ultra-processed food, increasing fiber in your diet. So a lot of guys get very obsessed about protein but have hardly any fiber. Fiber is really important for cholesterol, for cardiovascular risk, for gut health. So making sure you're having enough fiber as well, not just eating endless protein. Sleep, exercise, stress. Like these are just core pillars of good health, whether you're on testosterone or not, whether you've got testosterone deficiency or not, these pillars are absolutely like essential pillars of good health.
We need to talk about the impact and the benefits you've seen to your patients through TRT.
Mm-hmm.
What happens to their body? What changes in their life?
Sure. So, like I said, if you have a true diagnosis, it can be absolutely transformational in terms of your desire for sex and often then your relationship, So often, sometimes it's a partner who's tried to say, I think, there's something going on, get some help. And then the change in your sexual self and your confidence, your motivation, how that all feeds in. Like erotic energy, sexual energy is much more than just sex. It's about how you go about the world, how you feel about yourself, and it is an important part of relationship. So definitely impacts in all of those areas, and motivation, ability to work, all of these things. In terms of longer term, and all of those changes happen quite quickly. If you're truly deficient, within 3 months, certainly by 6 months, like sexual desire, energy, and erections often all improve. But things can take longer, and definitely changes more around body. So fat percentage, muscle takes longer, kind of 12 months plus.
Okay, so me as an example, right?
Mm-hmm.
If I thought let's imagine I have good testosterone levels.
Yeah.
But I want to be musclier.
Mm-hmm.
I want a hairier chest. I want to feel much more sexually charged.
Right.
So I think, okay, how do I get my hands on some testosterone?
Yep.
And I lie on an online test. They send it me in the post and I start injecting myself. And then my testosterone goes through the roof.
Mm-hmm.
Is that a bad thing to do?
Yeah. So, okay, now we're getting to it. So there's two things. So firstly,